We are going to talk about weight loss alternative medications. But, before you try weight loss medication, try other methods like reducing your portion sizes of the meals, avoid cravings by removing sweets from your food, and managing cravings with healthy non-sweet drinks like green tea, black tea, white tea, coffee, and yeast extracts like Marmite. If it is hard to stop snacking too much, select healthy nuts, but in moderation as a replacement. GLP1 medications are expensive, sometimes hard to get and also cumbersome to apply. They include Ozempic, Wegovy, Rybelsus, liraglutide, Victoza and Trulicity, to name a few. But there are cheaper alternatives with similar effects and more benefits for your health, including protecting your heart and kidneys. We are going to look at 5 other medications in this video. SGLT2 inhibitors, or sodium glucose cotransporter 2 inhibitors like canagliflozin, ertugliflozin, dapagliflozin, and empagliflozin may lead to weight loss and improved blood sugar control in people with type 2 diabetes. We will go into each one of them in detail later in this video. They are approved by most governments, including the Therapeutic Goods Administration or TGA in Australia, FDA in America, and the Central Drugs Standard Control Organization (CDSCO) in India. But you need to avoid medications that cause weight gain. They include insulin, sulfonylureas like glipizide, gliclazide, tolbutamide, metiglanide like repaglinide, and thiazolidinediones like pioglitazone. If the names start with the letter G, it could be medication causing weight gain. Always talk to your doctor and change medication in consultation. Also, most of the above medications can cause hypoglycemia, which can be fatal if not recognized and treated quickly. Metformin is a common medication used to manage type 2 diabetes. While it wasn't specifically designed as a weight loss drug, some studies have found a link between metformin and weight loss. Here's what you need to know and how metformin works. Metformin primarily lowers blood sugar levels by reducing the amount of glucose released by the liver. It also improves insulin sensitivity, allowing muscles to use glucose more efficiently. Lower insulin levels can lead to better overall health and reduced risk of complications associated with high blood sugar. The relationship between metformin and weight loss is not fully understood, but several theories exist. Reduced hunger cues. Some studies suggest that metformin may affect hunger cues, leading to decreased appetite. Improved blood sugar control. Better blood sugar management may indirectly contribute to weight loss. On average, people with diabetes taking metformin experience weight loss ranging from 4 to 7 pounds per year. However, individual responses can vary. Can non-diabetic individuals take metformin for weight loss? Yes, metformin can be used for weight loss even if you don't have type 2 diabetes. It is very unlikely to cause hypoglycemia in diabetics if used alone or with SGLT2 medications. Hypoglycemia is a serious condition which can be fatal if not treated quickly. While we are in the middle of the video, it is essential to consult with a healthcare provider before starting any medication, including metformin, for weight management. SGLT2 inhibitors, also known as gliflozins or flozins, are a group of medications initially developed to manage type 2 diabetes. Their primary function is to lower blood glucose levels by increasing the excretion of glucose in the urine. However, their benefits extend far beyond glycemic control. The SGLT2 inhibitor family includes the following drugs: canagliflozin, Invokana; dapagliflozin, Forxiga; empagliflozin, Jardiance; ertugliflozin, Steglatro. SGLT2 inhibitors are effective at slowing the progression of kidney disease in people with chronic kidney disease (CKD) and type 2 diabetes. These medications reduce the risk of kidney failure and death in individuals with CKD. Remarkably, SGLT2 inhibitors also protect the kidneys in people with CKD who do not have diabetes. When SGLT2 inhibitors remove sugar from the urine, they also flush out salt and fluid. This reduction in salt and fluid workload on the kidneys contributes to their protective effect, reducing heart failure risk. SGLT2 inhibitors have emerged as powerful allies in the fight against heart failure. They lower the risk of heart failure in people with type 2 diabetes and CKD. By improving cardiac function, these medications enhance overall cardiovascular health. 2018 review found that SGLT2 inhibitors were linked to a reduced risk of stroke, heart attack, and death from cardiovascular disease in people with type 2 diabetes and hardened arteries. Their ability to slow the progression of cardiovascular disease makes them invaluable. Common side effects: hypoglycemia or low blood glucose. This usually occurs when SGLT2 inhibitors are used alongside other diabetic medications. Adjustments may be necessary to prevent hypoglycemia. Dehydration. These medications increase urine volume, potentially causing dehydration. Stay hydrated by drinking fluids. Urinary tract and fungal genital infections. Increased glucose in the urine raises the risk of infections like thrush around the genital area. Proper hygiene and loose-fitting underwear can help prevent this. Also, another trick is the stick to low-carbohydrate diet to reduce the amount of glucose going out with urine. Uncommon side effects: increased acid in the blood or diabetic ketoacidosis. Rare but serious, this condition can occur even when blood glucose is normal. Seek medical help if symptoms like nausea, abdominal pain, or rapid breathing arise. Foot disease. If you're at risk for foot problems, consult your doctor before starting or continuing SGLT2 inhibitors. Other medications for weight loss. Orlistat is a medication used to treat obesity by preventing the absorption of fats from the human diet. Let's explore more about this weight loss medicine. Orlistat works as a lipase inhibitor, blocking enzymes in your gut that digest fat. Approximately 1/3 of the fat you consume is not absorbed into your body and is instead passed out with your stools. By reducing caloric intake, Orlistat contributes to weight loss. Phentermine topiramate, sold under the brand name Qsymia, is a combination drug that combines phentermine and topiramate. Let's explore its uses, benefits, and potential side effects. Phentermine topiramate is used to help adults and children aged 12 years or older who are obese, or certain adults who are overweight and have weight-related medical problems, to lose weight and prevent weight regain. It must be used alongside a reduced calorie diet and an exercise plan. Mechanism of action. Phentermine works as an appetite suppressant by affecting the central nervous system. It reduces hunger and food intake. Topiramate, originally an anti-epileptic drug, it also has weight loss effects. Its exact mechanism is not fully understood but may involve appetite regulation and altered taste perception. Weight loss benefits. The weight loss achieved with phentermine topiramate is modest. If less than 3% weight loss is seen after 3 months, it is recommended to stop the medication. Side effects. Common side effects: joint pain, ankle sprain, flu-like symptoms, dizziness, constipation, numbness or tingling, sleep problems, insomnia, dry mouth and changes in taste, mood changes and feelings of low self-worth. Serious side effects: unusual changes in mood or behavior, confusion, trouble concentrating, speech or memory problems, fast or pounding heartbeats at rest, seizures. Signs of kidney stones, severe pain in the side or lower back, painful or difficult urination. Signs of too much acid in the blood, loss of appetite, tiredness, irregular heartbeats. Warnings. Pregnancy. Do not use if you are pregnant or planning to become pregnant. Phentermine topiramate may increase the risk of a birth defect called cleft lip and palate in a newborn. Resting heart rate. It can increase your resting heart rate. Inform your doctor if you experience fast or pounding heartbeats while at rest. Vision problems. Topiramate may cause vision problems that can be permanent if not treated quickly. Bupropion naltrexone, sold under the brand name Contrave, is a fixed-dose combination medication used for the management of chronic obesity in adults. Let's explore its components and how it works. Bupropion, an antidepressant that can also decrease appetite. Naltrexone, typically given to block the effects of opioids or alcohol in people with addiction problems. Interestingly, naltrexone may also curb hunger and food cravings. Purpose. Bupropion naltrexone is used alongside a reduced calorie diet and increased physical activity to help obese or overweight adults lose weight and prevent weight regain. However, it will not treat other weight-related medical conditions like high blood pressure, diabetes, or high cholesterol. Side effects. Common side effects include nausea, vomiting, diarrhea, constipation, headache, dizziness, and dry mouth. Serious side effects may include changes in mood or behavior, liver problems, and severe skin reactions. Above you see a video related to health. Do not forget to click the like button and subscribe. Thanks very much for watching this video. Subscribe to my channel. Remember to consult your healthcare team before starting any medications.